Hi, this is Alfred Brock from the Wayne Focus. Today we're going to be dealing with something a little more general about health and the relationship between drug use and viral infections. Again, this particular information is available to you at www.drugabuse.gov. The link will be at the bottom in the remarks section on this video. But I'm going to go through this material with you. If you have any questions, you can go check it out there. You can send me a contact. I'd be glad to get back with you. So what's the relationship between drug use and viral infections? Well, drug use increases risk for getting or passing on viral infections because certain viruses can spread through body or blood or body fluids. And this happens primarily in two ways. When people inject drugs and share needles or other drug equipment, including marijuana, cigarettes, and when drugs impair judgment and people make unwise, unprotected choices related to intimate contact with an infected partner. Now, this can happen with men and women. Women who become infected with a virus can pass it on to their baby during pregnancy, whether or not they use drugs. They can also pass HIV to the baby through breast milk. Drug use can also affect the symptoms a person has from a viral infection, so it can make them worse or more increased. Viral infections of greatest concern related to drug use are HIV and hepatitis. Now, what is HIV/AIDS? HIV stands for Human Immunodeficiency Virus. This virus infects the body's immune cells, called CD4 cells, that is T cells, another reference for them, which are needed to fight infections. HIV lowers the number of these T cells in the immune system, making it harder and harder for the body to fight off infections and disease. Now, acquired immune deficiency syndrome, or AIDS, is the final stage of an HIV infection when the body is unable to fend off disease. A healthcare provider diagnoses a patient with AIDS when that person has one or more infections and a T cell count of less than 200. Being infected with HIV doesn't automatically mean that it will progress to AIDS, but it's a serious situation and should be addressed. Now, more than 1.2 million people in the United States live with an HIV infection, with 156,300 approximately who are unaware of their condition. So that's a large number. That's a measurable percentage that they're unaware of their condition. They're not taking care of themselves and they're putting others at risk. Now, while there are medicines that help prevent the spread of HIV and its progression to AIDS, there is no vaccine for the virus and there is no cure. Drug use and addiction have been inseparably linked with HIV/AIDS since the beginning of the epidemic. The link has to do with heightened risk both of contracting and transmitting HIV and of its worsening consequences, right? Now, what is hepatitis? Hepatitis is an inflammation or painful swelling and irritation of the liver. It affects your liver, one of the most important organs of your body, most often caused by a family of viruses, and they're A, B, C, D, and E. So primarily there's 5 different types of this virus. And there may be more because this is this is biology and this is what we know about. Each has its own way of spreading to other people and its own treatment. Hepatitis B, sometimes referred to as HBV, and hepatitis C, sometimes referred to as HCV, can spread through sharing needles and other drug equipment. Infections can also be transmitted through risky sexual behaviors linked to drug use, though this is not common with HCV. I'm sure it doesn't matter to the virus. Now, hepatitis can lead to cirrhosis, which is scarring of the liver, resulting in loss of liver function. It can also lead to liver cancer. And in fact, HBV and HCV infections are the major risk factors for liver cancer in the United States. There is a vaccine to prevent HBV infection and medicines to treat it. There are also medicines to treat HCV infection, but no vaccine for prevention. Some people recover from infection without treatment. One medicine for HCV infection has been found to cure some people, and other people need to take medicine for the rest of their lives and be monitored for liver failure and cancer. So again, drug use is producing these very real dangers and impacts on the personal life of an individual that are far beyond the momentary pleasures that they might occur or think they're getting. Now, how does drug use affect symptoms and outcomes of a viral infection? What happens afterwards? The person's using drugs, they're sick. What's going on? Well, drug use can worsen HIV symptoms, including causing greater nerve cell injury and problems with thinking, learning, and memory. And that's common knowledge about the memory. But thinking and learning in general is impacted, okay? And their behavior, the individual's behavior will change, maybe limited, and you don't know what's going to occur. Now, drug and alcohol use can also directly damage the liver along with the disease, increasing risk for chronic liver disease and cancer among those infected with HBV or HCV, so it can make the hepatitis worse. Now, how can people lessen the spread of viral infections. People can reduce. There's a way to do that. Right? People can reduce the risk of getting or passing on a viral infection by one, not using drugs. I know. I used to, don't say no. Does it work? Right? So don't say no. That might work. Get out of my face. I don't want it anymore. Get away. That might work too. But don't use the drugs. However, that's one way. Not using drugs. This decreases the chance of engaging in unsafe behavior, such as sharing drug use equipment, having unprotected sex, which can lead to these infections. So, eliminate that. You eliminate these other problems, right? Great. Now, number 2, getting treatment. People in treatment for drug use should receive counseling to learn how to stop or reduce their drug use and related risky behaviors. I know these are simple things that I'm saying. So if you're in drug use and you know all about that and you're having problems withdrawing and everything, this material is specifically for those folks that don't know anything about it. And let me tell you, most Americans don't know anything about this, and you need to educate them. Now, healthcare providers can use seek, test, treat, and retain model of care to seek out and test hard-to-reach people who use drugs and offer them treatment. And you can read more on the website I'm going to post for you. Finally, getting tested. People who use drugs should get tested for HIV, HPV, and HCV. Look, you're using drugs, go see the doctor. Keep healthy, right? You got to do it. You're putting your body in, and if you don't have enough money to do that, well, there's some more reasons to work things around. Those who are infected may look and feel fine for years and may not even be aware of the infection. So find out early, get it taken care of. Therefore, testing is needed to help prevent the spread of disease among those most at risk and in the general population. So if you know you have it, you don't want to give it to somebody else, do you? If you don't have it, you don't want to get it, no matter who you are. Now, read more about that at this webpage I'm going to give you. We're going to go over points to remember, and then we're going to conclude this one item. I want to thank you for listening today. So let's go through the points to remember. Drug use increases risk for getting or passing on viral infections of many different types. We talked about some very serious ones today. You don't even want to get down with a cold, do you? So anyway, people can get or pass on a viral infection when they inject drugs and share needles or other drug equipment. Drugs also impair judgment and can cause people to make unwise and unprotected choices related to intimate contact with an infected partner. Important stuff. Women who become infected with the virus can pass it on to their baby during pregnancy, whether or not they use drugs. Big deal. That is a big deal. The viral infections of greatest concern related to drug use right now are HIV and hepatitis. For me, it's all of them. Don't want to get sick from any of this stuff. Don't want to do that. People can reduce their risk of getting or passing on a viral infection by not using drugs. Don't do that. Getting treatment. Go to the doctor. Go to the doctor. And getting tested for HIV and HCV. Getting tested for those two things, for HIV and the various types of hepatitis. Get that taken care of. Take care of yourself. You're an important person. Have a great day.